Kate Osborne. Okay. Thank you. Order. Now, before I call Elliot Coleman to move the motion, it may be helpful if I just say this is a very heavily subscribed debate and may well have to impose a 5-minute time limit, but the more members keep their own contributions brief, the more likely it is I can avoid doing that. Elliot Coleman to move the motion.
Thank you, Sir Graham, and it's a pleasure to serve under your chairmanship, and in heeding your words I will try to keep my remarks as short and as brief as possible. I beg to move, Sir Graham, that this House has considered e-petition 613556, entitled "Ensure Trans People are fully protected under any conversion therapy ban." The prayer of this petition states, and I quote, "Ensure any ban fully includes trans people and all forms of conversion therapy. It is shameful that the UK intends to deliberately exclude trans people from a ban, in contrast to the approach taken by many countries, despite trans people being at greater risk of experiencing these harmful and degrading practices. The government's own figures show that trans people are nearly twice as likely to be at risk of experiencing the harmful and degrading practices of conversion therapy. A ban needs to ensure all forms of conversion therapy are banned." The petition remains open, and as of this morning, when I checked writing this speech, there was over 145,000 signatures, including over 220 from my own Carshalton and Wallington constituency. So, Graham, I'd like to begin by thanking the petition creator and many of the organisations and charities that have come forward to help brief me, and indeed I know colleagues around the heavily packed chamber, which has gotten even busier from when I last looked up from my notes, in advance of today's debate. And if I could say so, it's great to see the public gallery so full as well. Now, Sir Graham, there's no doubt that trans issues have caused something of a polarisation in the UK, with threats, intimidation and even violence being directed from both sides of the debate to the other. And no doubt today will sadly amount to much of the same, particularly with horrible things being said on social media. I would gladly give away.
Okay. I apologise for not being able to miss out on the meeting. I've got 5 o'clock for the whole of my constituency. He's talked about the vile way some people are treated. I think that probably includes the way Kathleen Stock and Helen Joyce have been treated, who've given very fair descriptions of trans issues, and yet have collected a great deal of bullying and online harm from people who ought to be saying, can't we try to work together to do sensible things?
I'm grateful to my honourable friend for that intervention, and I think it highlights the fact that, yes, we do need to have respectful debate on both sides of this argument. But I think it would be helpful for the purposes of today's debate to narrow down exactly what it is that the petition is asking for, and indeed what this debate is all about. To be crystal clear, this debate today is not about reforming the Gender Recognition Act, nor is it about access to single-sex spaces, trans women in sport, trans women in prisons, or any of the other issues that have caused such a stir in this place, in the media, in academia, and beyond. This debate and this petition is specifically about the harmful practices of so-called conversion therapy, and whether we think, as a House and as a country, we think it's acceptable for anyone, regardless of who they are, to be subjected to such things with no recourse to justice. And my argument today is no. I don't think that anyone should be denied access to justice if being subjected to these abhorrent practices encapsulated by so-called conversion therapy. I'll gladly give way.
Thank you. Does my honourable member friend agree with me, though, that there's enough laws already in place to cover all these abhorrent practices that he talks about, and this will only actually create a problem with freedom of speech, that people will be able to talk to their individual children themselves about the way they feel about themselves?
I'm grateful to my honourable friend for that intervention, but I'm afraid I just don't agree. There is nothing in the proposals, in the consultation that the government set out, which suggests that this would have an impact on freedom of speech. And whilst a lot of the practices, and indeed the point that I was going to come on to in a minute, are indeed already outlawed, there are many forms of conversion practices which aren't, and that's why I believe a ban is necessary. I will gladly give way.
I thank the honourable member for giving way. In relation to the previous point that was just made there,
does he agree with me that the fact that so many respondents to the government's survey showed that they had either been offered or subject to conversion therapy themselves shows that conversion therapy does exist specifically for trans people?
I do totally agree, and indeed the LGBT survey of 2018 showed that trans people were twice as likely as LGBT people to be offered and undergo conversion therapy. Now, these practices can take many forms, but the evidence that has been presented shows that all have the same aim and all are harmful. That is, of suppressing or changing someone's sexual orientation and gender identity. And indeed, whilst it is true that many of the harrowing stories we have heard of things such as corrective rape and physical assault, which many survivors have come forward to share those stories of, are already illegal, I will gladly give way.
I do apologise for missing this very opening remarks, but rape is already an illegal offence. Can he identify an offence that will be included in the bill but is not already an offence? What is the offence that's going to be created?
I'll gladly identify that. So yes, as I just said, that rape is of course already illegal, but it's the pseudo-psychological and spiritual so-called talking and behavioural therapies, exorcisms, deliverance prayers, etc., things like this, which are not currently illegal, which are included in the course of this ban, and indeed making it an aggravating factor when prosecuting. That is what currently is not in law, which is necessary. I will give way first here and then to my honourable friend.
I thank the honourable member for giving way. Would he agree with me that there is ample evidence to show that transgender people submitted to any form of this conversion therapy suffer greater potential psychological impacts, including harmful outcomes and lifetime suicide attempt risks?
I do absolutely agree with the Honourable Lady, and I've had the privilege of listening to many survivors who have come forward to share their stories, and I'm sure many people around the House have, which have demonstrated just that fact, and I'll happily give way.
Thank you for giving way. The practices he's just described, basically exorcisms and I would describe as witchcraft, frankly. Does he agree with me that we are dignifying such abhorrent practices by calling them therapies?
I absolutely agree, and I think that's where language, and I think this is going to be the theme of my speech, is where language is so important. The tight wording of a ban is very much important, and I think this is where language is so important, and I think conversion practices is a much better description than conversion therapies. I only use conversion therapy for the sake of today's debate as the go-to term. I'll gladly give way.
I thank the Honourable Gentleman for giving me way. Would you agree with me that part of the concern about a ban, I think wrongly, is that it would catch people who are engaged in legitimate therapy aimed at relieving emotional or psychological distress?
I'm grateful to the Honourable Gentleman for that intervention, and absolutely that is a concern that has been brought forward. But as I hope to go on later on in my speech, I think there is a way that we can alleviate those concerns and still pass an inclusive ban. And at this point, I do want to thank again the survivors that came forward to share their stories, because it is true that this is happening today in the UK right now. This isn't something that happened decades ago and doesn't really happen anymore. These kind of practices are still happening in the UK today, or indeed, if not here, the threats or the actions of sending people overseas to undergo such practices as well. That is still happening. I'll gladly give way.
Him for giving way, and I commend him for listening directly to those who have been affected by this. It's very often the voices of trans people that are missing from this debate. I was contacted by a constituent who said, as a trans woman, surely I deserve to feel safe, have some dignity and live my life in peace without being demonised. Does he share my concern that the way that this exclusion has happened serves to further demonise an already demonised group?
I'm grateful to the Honourable Lady for that intervention, and I do absolutely agree with her. I'd like to go on to talk about some of the concerns that have been brought forward about a trans-inclusive ban, particularly which is focused around the unintended consequences, the potential for criminalising conversations, legitimate conversations, between trans people and, for example, their parents, their doctors, or their religious leaders. And these concerns are, of course, legitimate, and it comes down to us as legislators to ensure that we pass good legislation which does not catch these out. But I know I have seen, and many other honourable members have seen, the legal evidence provided to the Government Equalities Office, which does show that it is perfectly possible to pass a ban without such unintended consequences. And what is important here is having a tightly worded bill with clear language, but also an extensive list within the legislation about what is and what isn't intended to be caught by a ban on conversion therapy. Because, let's be very clear, from campaigners who have been fighting for this, the ban is not intended to capture these legitimate conversations, questions, or even disagreements between individuals and their parents, doctors, or religious leaders, for example. Legitimate, explorative therapies, the teaching of scripture, or even the ability to say that they do not agree with a person's identity is not intended to be covered within the scope of the ban and should be explicitly stated as such within it. Now, there is also an argument made that to exclude trans people is the right thing to do because sexual orientation and gender identity are different, so should not be covered by the same piece of legislation. And however, whilst these are different parts of a person's individual identity, to do so would create big problems for the government within law, as many trans people are also LGB and vice versa. Plus, I believe it would allow the conversion therapy of LGB people to continue through the back door by claiming that this is to be done because of their gender identity. And we've seen that happening already. I've heard cases of survivors come forward, who, particularly camp gay men and butch lesbians, for example, who have undergone conversion therapy because of their gender identity, not because of their sexual orientation. And I believe that this is the reason why all leading medical, psychological and therapy organisations back an inclusive ban, with 25 organisations signing up to the Memorandum of Understanding on Conversion Therapy in the UK. And indeed, more than 370 religious leaders from around the world are also calling for a ban on conversion therapy. But I don't think I can put the need for a trans-inclusive ban much better than this. And I'd just like colleagues to consider this perverse situation. And this is based off a real-life example, where you have a set of twins, one gay and one trans. Both are forced to undergo hours of talking therapies to get them to change their identity. They're taken for exorcisms with people shouting over them. They're monitored to ensure that they're meeting anyone who might be considered wrong and unable to seek out accredited counselling and support, and have to endure treatment which is degrading and shaming.
Would you allow me on that?
I will happily give way.
I'm very grateful because I genuinely have come to this debate to learn about the issues. I thought the most important word he just uttered was the word forced. I think everybody could agree that no one should be forced into any sort of therapy. The question is, would you be banning people from seeking such therapy if, for whatever unaccountable reason, they wish to do so? That's where a line needs to be clarified.
I'm grateful to my honourable friend for that intervention. Indeed, there is a consent clause within the bill. Now, that is an entirely separate debate. I know there's many colleagues on both sides of the House who don't agree with that, and I'm one of them, but I'll happily give way.
And I'd just like to say, I think that we're missing the point here that actually the therapy in itself is the issue and is what is likened to torture by many, many leading organisations. On sexual violence, LGBT survivors, according to Gallup, 24% of people they spoke to had sexual violence. That's in general, but that leaped to 35% and 32% for non-binary and trans men. Do you agree with me that we shouldn't be creating spaces that are safe for people to perpetrate sexual violence against individuals?
I'm grateful to the Honourable Lady for her intervention, and I do absolutely agree with her. And that, again, comes back to the general theme of this debate, for me at least, which is that this is about harmful practices and whether we think anyone, regardless of who they are, should undergo harmful practices. And my answer very much is no. I'll happily give way.
This really important debate. He's making an excellent speech. The United Nations report in 2020 called for a global ban on conversion therapy, and it highlighted that such practices constitute an egregious violation of rights to bodily autonomy, health and free expression of one's sexual orientation and gender identity. Would he agree with me that there's real clarity in that and that it's very useful for this debate?
I'm grateful to the Honourable Lady for her intervention, and I do absolutely agree with her. I'm just conscious of time, Sir Graham, so I will start to wrap up my remarks so we can get on to other people's contributions. Going back to that example of a set of twins where one are gay and one is trans, as the proposals stand at the moment, the law would only protect one of those two individuals. This means that it would leave the other open to continue to be subjected to such practices with no legal protections. And by deliberately excluding trans people from the ban, I believe the message that we send, therefore, is that such behaviour is acceptable to inflict on someone because of who they are, and that it just cannot be right.
Thank you very much indeed. I think there seems to be a bit of confusion about exactly what this so-called therapy entails. It's worth perhaps saying that these coercive and abhorrent practices do not work. Abhorrent practices, these are the words of the Conservative government, by the way, although, of course, they've done a reverse ferret on this. Perhaps for those who come to listen with open minds, you might explain what the abhorrent practices involve and why they're not voluntary.
Absolutely. There is the people who undergo this therapy, and this comes back to the argument about consent, is that can you actually consent to having harm done upon to yourself, even if you have all the facts? Well, obviously, for me, the answer is no. And I think that, again, comes back to the core point of this for me, which this is about abhorrent practices, this is about harmful practices, this is about things that cause people to undergo years of psychological therapies to try and get over having been done to them, which is why I think that they do need to be banned in law. And so, Graham, that comes back to my summary, really, the end of my remarks, which is that what this boils down to, in order to achieve a trans-inclusive conversion therapy ban without unintended consequences, is frankly what we should be doing anyway. In other words, producing good, tightly worded legislation. And this has already been achieved in multiple countries and territories with no unintended consequences whatsoever. So we have international working examples to draw upon already in the drafting of this legislation. All sectors of UK society, from health to religion and others, have supported calls for a trans-inclusive ban, and that, after all, is what this debate is all about. It isn't about the noise about trans issues, which I mentioned at the beginning of my remarks. This is about protecting people from harm, no matter who they are. We have a duty, as parliamentarians, to protect the people that we serve from harm. So I urge colleagues to join me in exercising that duty today.
Sorry, have you concluded?
I have concluded, yes. Thank you.
The question is, this House has considered e-petition 613556 relating to transgender conversion therapy. Before I call the next speaker, I'm just going to start with an informal 5-minute time limit. If you can keep to that, then I won't have to impose a formal one. Luke Pollard.
Thank you, sir. Thank you for calling me so early in the debate. It was a privilege to listen to the member for Carshalton and Wallington in describing what needs to be a debate where we dial down the hate and we dial up the understanding. I'm here to speak on behalf of the trans and non-binary friends and their allies in Plymouth, 482 of which have signed this petition. I'm proud to be Plymouth's first ever out Member of Parliament, and I take that responsibility seriously to provide a voice for LGBTQ plus people, to call out hate and extremism, and to proudly say, love is love, whoever you are. I've spoken in this place before about my view on trans people, and so, Graham, we may be in a debate, but trans people are not up for debate. They exist. The only question is whether the government recognises their existence and the rights that should go with that existence. So my view on this one is clear. Trans men are men, trans women are women, and being non-binary is valid. But in that space, we need to educate and inform, not just hit each other over the head with sticks. And it is important that we conduct that debate in that way. I think it's very welcome that at long last we have proposals to ban conversion therapy for lesbian, gay and bisexual people. This is a huge victory. It is a result of an awful lot of work, and I'm grateful to the campaigners from Stonewall, Mind Out, the LGBT Foundation and many others for their tireless work on making the positive case of how stopping this harm to people will make a positive difference to society. This legislation has taken too long to come forward, but it's better late than never. Conversion therapy is abuse, and it is because it is cruel and abhorrent that young lesbian, gay and bisexual people are facing the cruelty, humiliation and violence that comes from conversion therapy, and it's right that that is banned. But if we are banning it because we think those practices are vile, we need to ban it for everybody, not making that artificial distinction between it. Very briefly, yeah.
I'm very grateful to my honourable friend, and he's making a very cogent case, as did the previous speaker. Isn't the point, though, in a free, democratic and liberal society, that this process of so-called conversion therapy smacks of the Soviet Union?
And surely it's not something in a society like ours we should condone.
I think the cultural reference might work better on someone perhaps of a different generation to myself, but I understand what he is trying to say in relation to this one here. But in the spirit of generosity that I'm trying to advocate, I think it is important that we make the case that everyone, regardless of who they are and who they fall in love with, should enjoy protections. And that is what the value, that is a British value that our schools, people are taught in our schools. I'll make some progress on my remarks. I kid your time limit. I might just make some progress if I can, because I don't want to run out of time if I can. The loophole that the member who introduced this debate spoke about, which creates a backdoor if trans and non-binary people are excluded from this ban, is not a backdoor, it's a trapdoor. It's a trapdoor through which young LGBT people will be pushed. It really is that case. And that's why we need to be absolutely clear on this, because intersectionality exists. You can both be trans and a lesbian. You can both be trans and bisexual. And that intersectionality creates a grey zone in the law that if the trans exclusionary ban for trans and non-binary people are allowed to be excluded from this, we will see more people fall into that. And that is not right. I'm going to keep going if I can just for one moment. So Graham, when I was a spotted, closeted teenager, there wasn't an awful lot of LGBT role models in society. There were no professional footballers, there were no Olympic athletes. They are now. We have visibility in our society now, and I'm so pleased with all my heart that young people in school now not only have LGBT people in the public eye, but they can see them on screen as well. And some of you will know that I'm an unapologetic fan of Netflix Heartstopper, and I remember being both Nick and Charlie at school. But for me, it's Yasmin Finney, who plays Elle in the show, who is not only epic in her acting, but the class and visibility of her as a trans actor and her transfer to the Doctor Who universe has not only inspired me, it's inspired young trans people across the world, and it has saved lives. That visibility, that legitimacy has saved lives. And I think it's in that world that, as Alice Osman has written in Heartstopper, where our diversity is celebrated, not excluded, where people are drawn together by a broad hug, not with a big stick, that we should be aiming for in this legislation. It is precisely because of that I think I would like every single member in this place to know that the message should go out to young LGBT people that regardless of who you are and who you love, you have the right to be loved, you have the right to be safe, and you have the right to be valued, not just by society, but in the law as well. And that is the heart of what we're debating today. Let's make sure that we say to young LGBT people, trans and non-binary, that they are enough, and we've listened to them, and we will value them.
Alicia Kurtz.
Thank you, Sir Graham, and thank you for calling me so early. I rise to speak today with a heavy heart because I don't think we should be here. This should not be something we are having to debate, and I am furious. But my fury is nothing compared to the deep-set harm that this announcement has already caused to the transgender community. They have been harmed by us saying that they do not deserve the same rights and protections as their LGBT brothers and sisters. The decision was made, in fact the entire ban was almost cancelled, shamefully, if it were not for the actions of backbenchers on the Conservative side to make sure it's protected. But the entire debate, and the entire manner of this debate, should shame us all, because we need more compassion on all sides, because there should not be any sides on this. So much of this debate is being misrepresentative and bears no reality to what a ban would really do. This ban is about preventing those who use so-called therapy as a smokescreen for their homophobic and transphobic exorcisms, who claim that LGBTQ+ people do not deserve to love, be loved, or live their lives as they truly are. So today, rather than arguing why we need an inclusive ban, I want to focus on the claim that any ban on conversion therapy would allow for only one form of therapy, so-called affirmative model. This is usually accompanied by a claim that the ban on trans conversion therapy is designed to push so-called gender ideology. I would like to know how these groups claiming this have seen the legislation, because I know none of us have. I know the Minister probably hasn't, because it hasn't been drafted. Conversion therapy often takes the form of one-directional talking therapies conducted by quacks in unregulated settings. There can only be one outcome: rejecting your trans self. Now, regulated psychotherapists and similar professions have always insisted that exploratory therapy has no set outcome, but that is what conversion therapy does. What our children, and indeed anyone trans of any age, deserves and needs is to have fully explorative and challenging conversations with accredited and regulated individuals. those who actually adhere to ethical tests, those who actually would be regulated and won't push predetermined outcomes in either direction. A regulated therapist would never say that someone must act on their attractions or feelings, or that they must eliminate them. And surely no one here can disagree with that. Now, some claim that gay and lesbian people are being forced to convert into transgender persons. Now, there are always isolated cases. You can never say never. But let's not suggest this is some widespread conspiracy. Even if you did ascribe to this belief, this legislation would help you because it would ensure that critical conversations take place with professionals and not the well-meaning. Now, let's take on the claims that a ban on CT would criminalise health practitioners, as my honourable friend started. Then how does the Royal College of Psychiatrists, the British Psychological Society, the Albany Trust, the British Medical Association, Mind, Relate, the Royal College of General Practitioners, Association for Christian Counsellors, and many more stand behind a ban? Conversion therapy has been rejected because it is the psychiatric and psychological profession precisely reject it because it's the opposite of an open-ended exploration. It is a therapy with only one stopping point. It's not about keeping choices, but eliminating them entirely. And that's why mental health practitioners back this legislation. It's not going to criminalise them, nor teachers, nor parents who want to have conversations with their children. And I know this because I have worked since my election to secure a ban on conversion therapy. I came to this place saying that I would help deliver one. Now, the discussions have been methodical, serious and cautious. And licensed bodies want to get this right, and they want serious safeguards in place. But I also want to be abundantly clear, given this search for safeguards, that psychological professions have been clear and unequivocal that trans conversion therapy is a definable concept. They might have different views about many other things, but they agreed on this. Now, looking at the Cass review, which many cite as a reason to exclude transgender people from a ban, the Cass review is unequivocal. It calls for expanded support for trans healthcare and better service provision. Hilary Cass herself has said that it is her view that her work does not impede the bringing forward of a conversion therapy bill including trans people, and any bill does not need to wait for the end of her work. So why is her work being appropriated against a ban? Her work is well underway. Finally, I just wish to clear up some of the misnomers around this bill, and I'm sorry I'm going to slightly run over. Despite how hard others are pushing to misrepresent it, this ban is not about transgender people in sport, or prisons, medical interventions, procedures, nor gender-neutral toilets. The government does not propose the ban would define gender identity in legislation, noting the fact we already have the Gender Recognition Act and hate crime legislation that acknowledges transgender people, and nor are LGBT community groups asking for gender identity to be defined or to introduce it into law. So why are so-called lobby organisations trying to say that we are trying to do this? I also wish to make one thing very clear. An inclusive ban on conversion therapy is not some woke frontier for those who want to suppress freedom of speech. This isn't some new frontier for politicians to weaponise in some culture war that they think is vote-winning. Because standing up for my rights, and I would hope that colleagues would agree that I have fought for the rights of women since I came to this place, is not incompatible with fighting for the rights of others. Women aren't people with cervixes, we're women. I don't chest feed, I breastfeed my baby. Of course biology matters, but these positions are not at war with one another. If we can come together, we can find mutual understanding, because this isn't a backdoor effort for those wishing to make this a battle about rights. It's not a backdoor effort to criminalise dissent from gender ideology, and it is about punishing practices that leave real and enduring psychological scars and holding those to account who cause this misery. The only people who have to fear this ban are those quacks and charlatans who profit off the bigotry and torture, who believe that their views are so superior to the others. So let's protect our children and leave the professionals to do their jobs, include transgender people, those to protect them from those so divorced from decency and compassion, so hell-bent on their worldview and their brand of torture that they would cause people to end up depressed with severe mental suffering and suicide. I, for one, will not stand for a ban that devalues my transgender friends, and I will amend this legislation if it comes forward without trans people included. And I will not stand for the division of the LGBT community that gives the green light to bigots to continuing torturing our trans friends. So I call on the government to do what is right. I call on the government to bring forward this work on transgender rights and inclusion within the bill that they have promised, and I ask them to stand by and give the protections to those who need it so very urgently. Thank you, Sir Graham.
Alan Smith.
Thank you. It's a pleasure to serve, and thank you for calling me so early as well. I do commend the Honourable Member for Carshalton and Wallington on an excellent speech. I'd also very warmly commend my friend, the lady from Melton, as well, for a very passionate, very genuine speech, and very, very pleased to follow her. But I was struck that Member for Carshalton and Wallington had to start by defining what this debate isn't about. And that's probably testament to just how poor this general, wider discussion in society has become. This is not about infringing anybody else's rights. This is not about infringing the rights of women or in general, but also to safe spaces. It's not about infringing the rights to free speech. And crucially, it's not about limiting the right to seek advice and help, and indeed the right to have an honest conversation. It's about conversion therapy, and it's about the harm that it does, and the need for action against it, and also the need, from my perspective and my party's perspective, to include trans people within that protection. To the gentleman who says that the existing laws already cover it, no, it doesn't. That's why we're here. That's why the position exists. That's why the harm is being done right now to hundreds of thousands of our fellow citizens, the most vulnerable people in society who need action and need our support. The existing legislative framework does not cover this. If it did, we wouldn't need to be here. There's a huge consensus that there needs to be action on this. The Scottish Human Rights Commission has said, it is well documented that the injury caused by practices of conversion therapy are grounded on the premise that LGBT+ people are sick, diseased, and abnormal, and therefore must be treated. Some practices can potentially amount to cruel, inhuman, and degrading treatment towards specific LGBT+ people, while the very existence of conversion therapy practices in our society promotes a culture in which LGBT+ people are seen as needing to be fixed, therefore undermining the dignity of all LGBT+ people. There's a consensus amongst religious organisations also that this needs to be tackled. We've got Ahmed Shahid, the UN Special Rapporteur on Freedom of Religion or Belief, is in favour of a ban. The General Assembly of the Church of Scotland, the Church of England, the Methodists, the Quakers and the Hindu Council of UK and many others. Any reputable psychotherapy organisation is in favour of a ban because they know the harm that these quacks, I was very struck by the Honourable Lady's mention of witchcraft earlier on, these quacks and the people that perpetrate this harm actually do to their own reputation. Now, the scale of the problem also is, by the UK government's own figures, considerable. Of the UK government's 2018 survey of 108,000 LGBT people, LGBT+ people, 2% have undergone therapy and 5% have been offered it. Now, in the trans community, it's even higher. 9% of trans men have been offered this therapy, which I would contend is odious in and of itself. Now, the question then surely just boils down to, for us as legislators, where do we draw the line? How do we draw the legislation? Now, in Scotland, we're doing this. In Scotland, this is a devolved competence, and the Scottish Government is committed to bring this forward with a trans inclusionary ban. And I trust the MSPs to draw the line correctly, to draw the line that will look after everybody's rights, because they're not mutually exclusive. But what we have, and I would make the plea to the English and Welsh and Northern Irish parliamentarians present, work with us. Nobody has the monopoly and wisdom of this. But listen to the experience. Listen to the harm that is very real, that is very genuine. Hundreds of thousands of our citizens right now are suffering from this practice, and many hundreds of thousands more are living with the consequences of having undergone it. There is a clear need for legislation on this. Please.
It's great to hear such a good debate on this. One of the concerns that many people have wrote to me about this is that the fact if a young person comes to them and thinks that they are trans, people are scared to go, well, why don't you just watch and wait? Why don't you just watch and wait? Let's have 6 months. Let's see how you feel in a year's time. Let's see how you feel in 2 years' time. People are going to be scared of saying that because they do not want to be penalised or caused transphobic, for one thing, or prosecuted under any legislation that may come later on. And I think that to be able to do that as a parent, to be able to do that as a teacher, to be able to do that as a man of the cloth, or any different things, just watch and wait. Why? That's all I want to be able to do. Watch, wait, why? I mean, that's where I'm trying to come from.
I'll take the intervention at face value as a genuine expression of concern, and this isn't an easy subject, and I'd be the first to acknowledge that myself, I would. But that's why we need to make sure the legislation's right. That's why we need to make sure the line is drawn at the right place. I said in my own opening remarks, here they are here, this is not about infringing the right of anyone to seek advice and have an honest conversation. And there is a world of difference between seeking advice and having an honest conversation and the quackery and harm that is being perpetrated by people who set themselves up in businesses doing this stuff. There's a world of difference. Please.
Just in reference to the previous intervention there, can I draw his attention to my honourable friend from Melton's speech, where she talked about forcing someone to change their gender identity or their sexual orientation. And isn't that what it's all about? You know, what's the intention behind having that conversation? So there's no problem with a parent having a conversation with their child, but actually if they're entering a conversation where they want to force someone to do something that is contrary to what they are, then that's crossing the line.
Yeah. I'm very grateful for the intervention. I'm a solicitor myself, if you go back far enough. The law is well used to dealing with shades of grey. In many other situations, aggravated hate crime, discrimination in different places, words that mean one thing in one context mean a different thing in another, it is perfectly possible to come up with a proper legislative framework to protect people and to protect precisely the honest conversations the gentleman's quite rightly concerned to see protected. I would share that concern and work with them upon it. I will, happily.
I thank you for giving way. Could he correct me if I'm wrong, but in terms of the waiting to see point, is it not right that it's currently at least 2 years to wait to have those conversations with a professional? So there is no rushing into this. And I may be wrong, but you cannot have surgery to your body if you are under 18, let alone get access to puberty blockers for at least a couple of years. So in terms of this rushing, I may be misunderstanding the timelines if you can advise me otherwise.
The Honourable Lady makes a very powerful and very apposite point. The idea that people can just wait, well, people are just waiting, including all the legislatures around this hall. We've waited far too long to act on this, and too many people are suffering during this. And the concerns that are raised need to be dealt with and respectfully discussed. But to my mind, there is a clear need to act on this. And I'll get to my conclusion yet, Sir Graham. There is a clear need to act on this. Too many people are suffering. And we have a duty as legislators to keep our citizens safe from harm. Let's act on this together. Let's work on this together to keep the people that we need to protect safe. Thank you.
Mr. Gibbs.
Thank you, Sir Graham. It's a pleasure to serve under your chairmanship, and I want to begin by congratulating my honourable friend, the member for Chisholton and Wallington, for leading this debate. And I also want to congratulate Samantha Harris, who I met last week, for starting this petition. As Samantha told me, the potential exclusion of trans people from a conversion therapy ban would imply that they don't count. Well, Sir Graham, trans people matter to me. Trans people matter to me as a member of the LGBTQ community myself, and trans people matter to me as members of my family. And trans people matter to me as members of the community I represent, not just the 208 people in Darlington who signed this petition. I do believe that this debate is somewhat premature, with draft legislation yet to be published, but I can well understand the shock, disappointment and dismay of the trans community and their allies that the abuse they face may not be included, whilst the abuse faced by their gay, lesbian and bisexual brothers and sisters would be. Since being elected in 2019, I've been privileged to work with some great people on the issue of conversion therapy, and I pay tribute to my honourable friend, the member for Rutland and Melton, who we've already heard from. She is an absolute champion, and I pay tribute to her. I also want to record my thanks to Jane Ozanne from the Ozanne Foundation for her incredible and tireless work on this issue. Jane, please know that your efforts are appreciated, and keep doing what you're doing. Our country has come a long way on LGBT issues, further than I would have ever imagined. For me, the banning of conversion therapy, or to call it what it really is, abuse, control and coercion, is the next logical and rational step on that journey. To seek to do that for only part of the LGBTQ community is, in my view, divisive and irrational. There are sadly some who do not believe that such practice exists, and those that believe that the existing law already provides enough protection. These abuses do exist, and the law does not currently provide a framework to protect the most vulnerable members of the LGBT community. This upcoming legislation is a great opportunity to right that wrong. I firmly believe that a ban on conversion therapy that includes all members of the LGBTQ community is essential. This abuse has no place in a civilised society, and I am personally committed to seeing all forms of abuse for LGBTQ people banned. Conversion therapy encompasses a wide range of practices that all share the belief that someone's sexual orientation or gender identity can and should be changed. It relies on the erroneous belief that LGBTQ people are sick and in need of a cure. These practices are cruel, harmful, and there is no evidence of them working. Having recently met with members of the local LGBTQ community in Darlington, I know my concerns are shared. I know they share my concerns about the potential exclusion of trans people from a future ban on these practices. So, Graham, today's debate is not about women in sport, safe single-sex spaces, or what the appropriate age is for treatment for a person experiencing gender dysphoria. I'll be happy to give way.
Thank you. I'm so glad that the honourable members and other members have made that point, because even as a member of the LGBTQ community myself, I recognise there are some real challenges in those areas. But this is not what this is about. This is about something very simple, that you cannot force or make someone to change their gender identity or their sexual orientation, and trans people need to be protected in the same way as other members of the community.
I'm grateful for that intervention, and I couldn't agree more. This is a difficult topic, and it's important that we are having this debate at this particular point in time. But I think it's important that all politicians are able to have an open and frank, honest discussion about this. This debate is about sending a signal to the most marginalised in our society, who already experience prejudice and discrimination. Your lives matter, and you should be protected from abuse, coercion and control just as much as the next person. To not include trans people in a ban on conversion therapy would be a great wrong, allowing loopholes in the legislation that will allow these abusive practices to continue to ruin people's lives. Trans people already face more discrimination than gays, bisexuals and lesbians, and seeking to divide the LG and B from the T will only marginalise trans people further. So, Graham, this issue is very close to my heart as a gay man myself, with friends and family who are lesbians, gay, bisexual and trans, and I can see just how much this issue affects real people's lives in my own family and in my constituency. So, Graham, I know that the Minister is a good man and a strong member and ally of the LGBT community, and I know that he will be listening very closely to this debate, and I hope that he will do all he can to ensure that conversion abuse covers trans people too.
It's Osborne.
Thank you, Sir Graham. It's a pleasure to serve under your chairmanship today. I'd like to open my contribution today by thanking the 145,000 people that signed the petition ensuring today's debate goes ahead. As politicians, we should always ask ourselves which side of history we are on. When the gay liberation movement first started, it had almost no support in the House of Commons. When queer communities came under attack from homophobes and the police, it was left to us to defend ourselves. Now, once again, this government seemed to want the House to be on the wrong side of history again. Well, I stand on the side of history that has learned lessons from the past. When queer communities came under attack from homophobes and the police, when AIDS arrived and its victims faced stigmatisation, I've seen these failures of government in protecting the LGBTQI+ communities firsthand, and I am steadfast in my belief that conversion therapy must be banned for all, including transgender people.
Thank you. I thank my honourable friend for giving way. Caroline is a trans woman in her 70s, recounting trans conversion therapy she underwent in her youth. She said, and I quote, "When I remembered it, I would physically shake. It made me hate myself. 40 years later, I still have flashbacks." Does my honourable friend agree with me that firstly, these practices are abusive and must be banned, but secondly, that the government's refusal to ban them is part of a cruel, cowardly and cynical tactic to distract us from their failings, to stoke up division and to target one of society's most marginalised and disadvantaged groups?
I thank my honourable friend, and I do agree with you. I agree that we need this ban to come in without delay, without loopholes, loopholes and without exclusions. And I give way to my friend.
I thank my friend for giving away. She's making an excellent speech, particularly the historical references, and those of us that were here during the grim days of Section 28 remember just how horrible it was and how brutal the media treated then LGBT communities. And this proposal to not include trans people in the conversion therapy ban is unbelievably wrong, divisive and very short-sighted. And I think we just need to be very clear that when this legislation comes along, I hope there will be a majority in this House that will actually say we need a total ban on conversion therapy, as the Scottish Human Rights Council and others have proposed in the earlier speech that was made. Now, does my friend agree with that?
I thank my honourable friend, and I do agree with that. And interestingly, he makes reference to Section 28. I think the first march that I went on as an activist was in opposition to Section 28 many years ago. Too many that I wish to care to remember. I'll give way.
I thank the honourable member for giving way, and it's touching to hear her talk about those historical references as well. Does she agree with me that the rights of LGBT people were only won by LGBT people, and if it wasn't for T people, we wouldn't have the rights that both she and I enjoy today?
I thank the honourable gentleman, and I absolutely agree that there should be no division, as the honourable member for Darlington made reference to earlier. We know from numerous studies and polls that transphobes are in the minority, but that minority, unfortunately, is hardening, and clearly they seem to have the ear of this government. As casual prejudice fills the airways and column inches, the government's failure to deliver a ban on conversion therapy for trans people sends a terrible message. We know that conversion therapy causes serious mental health problems for those who undergo it. It has driven people to suicide, with trans people twice as likely to have been offered conversion therapy than those who are cis, gay or bi. The government seems to be excluding the very people who the ban would help the most. In Britain today, around half of trans people attempt suicide before the age of 26. Many face harassment, bullying and discrimination on a daily basis. But as my honourable friend mentioned earlier, trans people and their very existence is not up for debate. Under the Prime Minister, the strategy of this government is to harness prejudice and stoke a culture war, pitting communities like this against each other. The fact that the Tories are undermining trans rights is not surprising. If the party opposite had a party motto, it would probably be, never let basic humanity get in the way of a potential vote winner. If the legislation being proposed does not include trans people, then it does not go far enough. It is essential to close all loopholes in order to prevent the possibility of this abuse continuing. The government knows that conversion therapy is abuse. They've clearly acknowledged that, yet they seem willing to allow an entire community to continue to be subjected to it. History can and has judged how wrong some of our politicians have been in the past, and it will judge those who fail to protect our trans community now.
Grateful to members for the brevity of their contributions. There aren't quite as many members standing as had indicated earlier that they would be. So I think we can relax the time limit a little bit, perhaps to 7 minutes. Jackie Doyle-Price.
Pleasure to be able to contribute to this debate. And, I think our starting point as legislators must be to eradicate harms, but also in doing so, not to create new ones. And it's in that spirit that I really want to address the proposals in. Well, we haven't got a bill yet, so we are sort of flying a bit blind, if I might say so. But my issue really is use of the term therapy in this space. And we've already had some discussion of that earlier on, because what we're talking about are coercive, harmful practices based on an ideological opposition to either being trans or being gay, lesbian or bisexual. And those are the things that we really need to be eradicating here. The term therapy, for me, implies something which is benign and designed to alleviate distress, which is clearly not something we want to outlaw in this space. And that would be for sexuality as well as gender. So my plea really is for the government to re-examine this language, because in respect of transgender identity, where the individual wishes to undergo medical transition or surgical intervention, a therapeutic pathway is absolutely essential to establish informed consent. And we must not allow any law to be passed which would get in the way of those conversations and clinical interventions, which is designed to alleviate that distress. Yes, indeed.
In the spirit of the point that I made in my debate, that there are no two sides, I agree with her entirely, and I suspect she will find much unanimity in this room that it should be about conversion practices. Yeah. And I'm sure that the Minister, who campaigned for many years for a ban on this before he became the Minister, will be very aware of this and be doing everything he can to make sure it's the right bill coming forward. So I agree with her entirely, and I'm sure the room will as well.
Well, I'm grateful for that intervention, and indeed, although I've been very outspoken on these issues, I've had this conversation indeed with Jane Ozanne, who again shares this. And I think, in terms of getting to a good law, my plea is to all of us. We've heard lots of rhetoric in the speeches today, but if we really focus on what we do to create a law which really eradicates harm but gives support where it's needed, I think we can generate consensus, notwithstanding the heat and noise that goes on social media. There is much consensus in this room. Now, I come to this from being the Minister for Mental Health with responsibility for gender medicine at the time that the Church of England General Synod actually passed the motion in favour of the conversion therapy ban. And it's worth remembering that at that stage it was only about sexuality and not about gender. That was subsequently added in. But at the time, I made it my business to look into exactly what the evidence was as to what the practices were we were trying to outlaw. And notwithstanding some of the references to experiences that we've heard, I could find no evidence of anything happening in a clinical setting after 1970. So it became very, very clear that we were talking about practices which were often based in religious institutions, and very much based on an ideological belief against same-sex attraction and transgender. And that's why I think we really need to really hammer down on outlawing exactly those things that we're trying to eradicate in terms of harm. And I think we've ended up with this vanilla term therapy for fear of alienating those people for whom these are issues of religious belief. And frankly, the risk of that outlawing what are legitimate interventions shouldn't be getting in the way of that. So I think we really need to be very clear about what it is we are banning, and being very, very clear that any therapeutic intervention which is designed to alleviate distress will not be eradicated by this legislation. And I really look forward to hearing some words of comfort from my honourable friend the Minister, with whom I've had many discussions about these things. I think it's also worth noting that the term trans can mean any number of things, from declaring yourself non-binary to wanting to go the whole journey of medical and surgical transition. And this is where I think the therapeutic care pathways are so important, because for some people, gender dysphoria is a permanent condition which does need to be alleviated with treatment. But for others, it can be a symptom of something else. This is not a straightforward condition that has the same pathology in all people that experience it. We know that it's prevalent amongst people with autism. We also know it's prevalent, it can often be a very common thing to experience by girls going through puberty.
I'm very grateful to the Honourable Lady for giving way, and I wonder if I can just ask her and any other members in the room thinking of making that connection between trans and autism to be more thoughtful about how they are expressing that, because there are a number of people watching and listening to this who will find that particularly unhelpful, and I think that we can probably be a bit more nuanced in our language.
Well, I think it is important that we actually really do understand what we're talking about when we look at gender dysphoria. It can also be a symptom of trauma. And it's very important that we have these therapeutic care pathways. And we can shake your head. I'm talking about this from experience, having looked deeply when being responsible for this area of medicine. And we do need to make sure that we're not putting people on irreversible care pathways which will do them harm. And, if we look at the example, for example, if I could continue, if we look at the example, for example, of the Tavistock, where, their care pathway is based on therapy, as many as 40% desist. So that's why it's important that people are given the space to explore
what they believe to be their gender, because it can often be about something else, of course.
I thank the member for giving way. Does she acknowledge the fact that puberty blockers, which I think is what she's referring to when she speaks about irreversible treatments, because that is the only medical treatment that under 18s can have, are not irreversible, and that the point is to pause puberty, which can be done for many reasons. For example, premature puberty, and the whole point of them is that they're not irreversible.
Puberty blockers are not irreversible. You're absolutely right. The actual fact of the actual fact of blocking puberty may mean that the individual does not subsequently go through it. But she's right in the sense that puberty blockers were invented for a different purpose than for the treatment of gender dysphoria. So where appropriate, they absolutely should be dispensed, but they should not be used as a way of treating gender dysphoria without having gone through that therapeutic care pathway. I should also add that, the real issue here is the provision of hormone treatment, which is routinely dispensed now through people from the age of 16. And again, the impacts of those things are irreversible. So we see now a generation of trans men who have desisted, who will now have, loss of sexual function, permanent, facial hair, male pattern baldness, where a more sophisticated way of allowing them to explore their gender would mean that they had not gone through such a thing. Yes, of course.
I'm making the mistake by, again, confusing what we are here to ban. And this is pseudo-practices. We are not aiming at banning NHS therapies and practices that are conducted by professional and medical experts. We are looking at banning conversion therapy, which is pseudo-scientific, often in private settings and not controlled.
General thesis, which is that we shouldn't be using the term therapy in this bill, because these are the legitimate care pathways are exactly the things that we should be making sure that people can access so that they actually get the right decision for them. Because as we do know, if we can't access them through the National Health Service, there's a wild west out there on the internet and people will start getting very harmful interventions which aren't properly supervised. Yes, of course.
Isn't the key to all this about the intention of whatever is going on? That with conversion therapy, you're setting out with a predetermined objective to stop someone from being something or forcing them to be something else. And all of the therapies that the member talks about are about an explorative process that may or may not, through the choice of the individual, lend to them taking puberty blockers or other things. The therapists themselves won't be entering into it with an intention to force them to do that or to stop them from being something else.
Again, I think my honourable friend is agreeing with me, and it is the term therapy that I'm objecting to on the face of this legislation because again we are dignifying these practices with that description, because therapies are exactly the things that I've been describing here, and there is no doubt that we need better care pathways for people with, to explore their gender, no doubt at all, and I know that my honourable friend will probably have something to say about that as well. So, I mean, that's really as much as I really want to say about it. I think we must make sure that we really call this practice out for what it is. We must make sure that the bill only eradicates those harmful practices. And we must make sure that we are really ensuring that very clearly that good, benign, positive therapeutic interventions will not be outlawed by this legislation.
Robert.
Therapy bill. I welcome this. It is progress. After all, I tabled a private member's bill to ban conversion therapy in the last Parliament. However, the detail of the government's proposal is, well, more than disappointing. The ban will protect people from therapies aimed at changing their sexual orientation, but not to ban therapies aimed at changing people's gender identity. If the government recognises the harm these cruel and medieval practices is causing to one group of people, why does it exclude the group that is the most harmed? Trans people are twice as likely as the rest of the LGBT plus community to be subjected to conversion practices. A recent survey found that gender conversion practices, far from working, create lifelong, deeply traumatic consequences for survivors. Nearly half of respondents said every aspect of their lives, from their mental health to peer and family relationships, had considerably worsened, and we all know that all too often these catastrophic mental ill health that is being suffered leads to loss of life. Gender conversion therapy is purposefully harmful and repressive. It targets already vulnerable people, and overwhelmingly so at a very young age. 3/4 of those who have undergone conversion therapy were under the age of 24. Some began as early as the age of 12. These so-called therapies or practices include verbal abuse, isolation, physical abuse, and perhaps most disturbing, corrective rape. For the exclusion of any doubt, we are not talking about professional medical treatment and therapy. I give way.
I'm very grateful, and does she agree with me that therapeutic and counselling interventions in this situation have to be non-directive, and that per se excludes anything which has a predetermined purpose, as we are discussing?
I totally agree. The damage about all these practices is that they have an outcome before you even start, and that is why these are so very damaging. I will give way.
Does she also share my concern that if we end up not banning this, that all it will do is encourage families to go further and further underground to seek practices, particularly through their churches? I've got a family who was reached out to by their church. They were then referred to someone, a quack in America, who then performed these abhorrent practices on a young teenager who immediately said to their parents, "This is making me feel like who I am is less than I am." Is she concerned that if the government doesn't act, then parents will not know where to turn?
I totally agree, and we have to sort of say this again and again and again. This is not about professional medical treatment and therapy. The conversion therapies that need to be banned are pseudo-scientific practices, often conducted in private settings, and most crucially, they do not have an open outcome, but are aimed to change what a person is. Legal advice recently published by the Good Law Project makes it clear that the government is risking to get embroiled in legal challenges by breaching Article 14 of the European Convention of Human Rights, and I quote the legal advice, such that the difference in treatment between sexual orientation and gender identity needs to be justified and proportionate. So far, the only justification the government has provided is to say that the issue is complex. So why are we even having this debate? Opposition to a trans-inclusive ban is entirely built on stoking fear and division based on deliberate misinformation. By the government's own admission, NHS gender identity services will not stop people having exploratory conversation with their doctors. Legal services will not be affected by a ban. And there is no evidence of any negative impact in the countries that have already introduced a ban. Let us be clear. We are talking about preventing the abuse of LGBT plus and gender non-conforming people, our fellow men. Furthermore, neither, and women, and non-gender identity people, we are talking about other humans. We need to prevent abuse. Furthermore, neither would religious freedom be affected by this change. Religious freedom is the freedom to worship without discrimination. I'm a Christian. I have the right to practice my religion without discrimination. I do not have the right to cause harm. The Church of England has acknowledged this, stating that conversion practices have no place in the modern world. Nearly all countries that have banned gay conversion therapy have also banned gender conversion therapy. Canada, France, and New Zealand, to name a few, have yet to encounter problems with freedom of speech or religious belief. It is baffling, and I do actually disagree. It's not about getting votes, that the Conservative government is not committed to ban trans-inclusive conversion therapy, because even their own voters are largely in favour of a trans-inclusive ban. Northern Ireland has pushed a motion to ban conversion therapy in all forms. Scotland is hoping to ban it by the end of 2023. This government must follow suit. The Equalities Minister called this country a global leader on LGBT rights, but it seems this government has forgotten what the letter T stands for. How can we possibly call ourselves global leaders if we knowingly, purposefully fail to protect trans people from these abhorrent practices? And I plead with the government to listen to what is overwhelmingly the consensus in this room and indeed outside this room, and make sure we ban conversion therapies in all its forms.
Thank you. It's a pleasure, Sir Graham, to serve under your chairmanship. I speak very much in support of a trans-inclusive ban on conversion therapy. I just wanted to start by giving some context to what's happening in relation to Northern Ireland, where the Northern Ireland Assembly has recently passed a motion on a ban on conversion therapy, which was carried overwhelmingly, but with the opposition of only two parties, the DUP and a smaller political party. It never occurred to anyone supporting that there would be a carve-out against the inclusion of trans people. And I would suggest that if that's possible in the context of a society that is perceived to be as conservative and has had a reactionary approach to a whole range of equality issues over the past number of years, then it does give encouragement that this is possible right throughout the UK and further afield. And obviously that is something that does need to be pursued. In terms of the reality of our situation, it is only a motion through the Assembly. And I think in practice, while some initial work has been undertaken by Northern Ireland departments, I think a large degree of credence will be given to what happens in terms of any legislation in England and Wales. And in that respect, therefore, it is important that action happens here quickly and also that it is got right. And by saying the word right, that means it is fully trans-inclusive. Same-sex sexual orientation and transgender identity should be considered, and they are perfectly normal situations. They are part of the human variation. They're something to be celebrated and embraced, and we should treat everyone with equality and dignity for exactly who they are without any question. And these practices of so-called conversion therapy say far more about those who seek to engage them than they do about the subjects. They're not about the welfare of those that they're seeking to impose these upon. They're about the hang-ups and the bigotry and the prejudice of those who are seeking to engage in that. It's because they cannot accept people for who they are. They have to force people to conform to their very narrow-minded approach as to what the world should be, in denial of that broader reality. The only other point I want to stress is just to really emphasise how vulnerable trans people are in our society. These are not people who are aggressors who are seeking to impose upon other people or to make life difficult. And obviously there's a much wider debate about gender recognition in that regard, which is distinct from what we're having today. However, it is worth stressing that in addition to people of a trans identity being much more likely to be subject to these so-called practices of conversion therapy, they themselves are probably people who have grown up marginalised in society. They're likely to have been subject to bullying, harassment, marginalisation, have had difficulty in terms of friendships. I've had a constituent in touch with me recently expressing concern about how isolated their child feels because they have a trans identity and how difficult it is to find people to engage with. And we're trying to work out and try to build some sort of support network for that person. So that's the daily reality that people are experiencing, and we should acknowledge that and seek to do all we can to help people, not to continue a situation where people can be abused and punished through what is in effect a form of torture. Thank you very much.
To speak today in support of a trans-inclusive ban on conversion practices, to represent the views of the 287 people in the City of Durham who've signed this petition. The Ban Conversion Therapy Coalition defines conversion practices as those directed towards a person on the basis of their sexual orientation or gender identity and for the purpose of changing or suppressing the sexual orientation or gender identity of the person. Proposals to ban gender conversion practices wouldn't affect legitimate clinical practices which are outcome neutral, nor would it outlaw explorative therapies or discussions or limit religious beliefs or private prayer. And the main reason I oppose conversion practices in all forms is because they are both harmful and do not work. Not only has a UN report found that conversion practices can amount to torture, the UK government has stated that there is no justification for these coercive and abhorrent practices, and the evidence is clear that it does not work. It does not change a person from being LGBT and can cause long-lasting damage to those who go through it, and I couldn't agree more. And there's clear consensus on this across the medical community, with all leading medical, psychological and therapy organisations, including the Royal Colleges of GPs and Psychiatrists, backing the trans-inclusive ban. And last but not least, conversion practices are centred around the belief that certain gender identities or sexualities are the worst possible outcome for that person. There's acceptance that it's wrong to try and convert someone from their sexuality because we believe that no one sexuality is more normal or moral than any other. So why shouldn't it be the same when it comes to gender identity? And before I finish, I want to touch on the flawed concept of consent. This morning I was in contact with Action for Trans Health Durham. They asked me to stress that there are countless avenues for someone to coerce a trans person into undertaking conversion therapy. This could be through the withdrawal of financial support, or access to loved ones, or by being deprived of accommodation. The fact that trans people are also more likely to suffer from poor mental health and homelessness makes them more vulnerable to exploitation. And even if we set aside the fact that these practices should be banned outright due to the harm they cause, the fact that we can never be certain that anyone is actually undergoing such practices willingly means that we must reject any consent loophole. I support a trans-inclusive ban on conversion therapy and to trans people and non-binary people because allowing such practices to exist not only puts people at risk of harm, it would also legitimise the idea that being trans is wrong, something I completely reject. And I hope that one day basic rights for trans people will no longer be the subject of debate. Trans people shouldn't be used as a political football. This government could show that it is on the side of the LGBT community by banning these practices, but it refuses. Instead, it would rather light up buildings with rainbows than make any meaningful change. So let me be absolutely clear, there is no LGB without the T. And I will always stand in solidarity with the LGBT community and their right to be who they are, the right to love whoever they love, and the right to exist. Thank you.
Thank you very much indeed, Sir Graham. I filmed a conversion therapy once. It was for a BBC documentary. I was a journalist before I became an MP, and that's when I first encountered a conversion therapist. He advertised himself as offering the last chance of a normal life, and of course this lured young vulnerable people who were terrified of who they are. Now, I watched as this untrained pastor told a vulnerable, distressed young man that he parted company with God, and that was why he was anguished about his sexuality. Clearly distraught, the young man told me that he would commit suicide if the pastor failed to cure him. Now, Sir Graham, the pastor's background was deeply disturbing, as I discovered, and this is why I want some honourable gentlemen and ladies present to be keenly aware of who we're talking about here, who are offering this so-called therapy. They're not experts who can help anyone, This pastor's own son had committed suicide some years before because he too had a, quote, dearth of masculinity, or so his father had persuaded him. The pastor showed me the suicide note that his son had written him. The lad had connected up the exhaust pipe of his car to the family garage. His handwriting on the suicide note had trailed off as he'd lost consciousness, and then as he'd lost his life as the fumes filled his lungs. His dying wish was that the father would understand that the love that he felt was real. He asked his father to meet his boyfriend and deliver him a note that he'd written and left. The pastor told me that he'd torn up that letter and recommitted his life to the conversion therapy which had led his own son to suicide. This was the man who was offering conversion therapy to the vulnerable with no controls under the law. Conversion therapy, which, breaking a manifesto commitment, the UK Conservative government has now, or appears now, to be choosing not to outlaw. Chair, we cannot allow this government decision, if we believe the intelligence briefings from Conservative backbenchers, it is a decision already made. It is our duty to do all that we can to protect young people from the unrepentant cruelty of the pastor and his ilk, wallowing in prejudice and in ignorance. For they are the reality of so-called conversion therapy. They take the most vulnerable in society, aiming to convince them that their nature can be altered. It's the cruelest of all deceptions. Now, once upon a time, the Conservative government agreed, and I quote, "There is no justification for these coercive and abhorrent practices." That's what a Conservative Party government document says. And I agree. The UK government's own research has found that trans people are twice as likely to experience conversion abuse as gay non-trans people. Gallup, the anti-abuse charity, found that 11% of trans people have been subjected to conversion therapies by their own families. Just imagine the cruelty. The very people who should be looking after you and affirming who you are the people who are taking you off to the place of greatest danger. Yes.
I've had a friend for giving way and totally agree with the points he's making. You'll also know that Gallup found that trans and non-binary people also faced a higher level of sexual violence than other members of the LGBT+ community, which was designed to convert them from their gender identity. That's the reality of what we're dealing with here and why it has to be a fully inclusive ban.
Indeed, because some of these sordid people, as my honourable friend will know, rape those that are sent to their so-called care in order to cure them of their sexual orientation or their gender identity. In the past year, Canada, France and New Zealand have all made the decision to ban trans conversion therapy. Scotland will shortly do so as well, I'm proud to say. Now, some members, we've heard earlier, say that they come with an open mind to learn. I believe in evidence-based policy making. So let's see what the experts say and who they are on this issue. The United Nations Independent Expert in Sexual Orientation and Gender Identity, the National Health Service, the Royal College of Psychiatrists, the Royal College of GPs, and the Royal British Psychological Society, along with dozens of health counselling and psychotherapy organisations across these islands, are calling on the UK government to end these practices for both gay and trans people. I would say they were the experts, wouldn't you? And just in case anybody's trying to hide behind some kind of religious veil, the Kirk, the ancient Kirk in Scotland, my own church, the church where generations of my family were ministers, the Church of Scotland, lent its voice to the growing chorus of organisations which support banning trans conversion abuse. It is not a religious issue. It's cruel, it's damaging, it doesn't work, and it is surely our duty as parliamentarians to stand always on the side of the vulnerable. Let's do so in this.
Here, here. Ruth Jones.
I want to acknowledge the opening remarks of
the Honourable Member for Carshalton and Wallington, because he framed this debate in the right way.
get on our high horse and, with a polarised position, and we must harness our experience and our insights, wherever they come from, to ensure that we make the right decision. As legislators, that is our job, to interrogate the purpose of any legislation and to ensure that it is fit for purpose and will deliver what it intends to do. My perspective on this issue really comes down to a position of information. So I remember back in the 80s when I started my nursing career and growing up in the 70s and 80s in Scotland, it was not the beacon of equality that it has become. It was a tough gig, to say the very least. But anyway, I remember on one of my first placements, it was on a surgical ward, and a bus driver was brought in with abdominal pain, rushed to surgery, had a laparotomy. They opened him up, discovered that he had extensive cancer, stitched him back up, came back to the ward, and that was the end of the discussion with him. He wasn't told. His family decided that he shouldn't be told the truth. Everybody was quiet about it, and this was not abnormal practice back then, that the patient didn't own the responsibility of that information. And that has fundamentally changed. We have a concept of informed consent now, where certainly in my experience, whether that was when I worked in adolescent psychiatry with dysmorphic anorexics, who we didn't affirm that their dysmorphia was real. We gave them therapy to help them resolve the challenges that they faced. Yes?
Is the member suggesting, correct me if I'm wrong, but it sounds like he's suggesting that anorexia, which is a very serious psychiatric condition and also the most deadly psychiatric condition, is as harmful as being trans, which is somebody's identity.
No, absolutely not. No, I'm talking about information and consent, and I'm not making that parallel at all. And during my clinical practice and my academic research, I conducted primary research into the supportive care of adolescents as they went through their cancer journey. And that grounded theory framed the supportive care as maximising personhood, so considering all aspects of that individual, how you would maximise who they were as they went through that journey and ensure that they were supported to be the best version of themselves despite the trauma of intensive treatment. So informed consent is something that children and young people are incredibly capable of dealing with. I've had conversations with young people about how they would like to, where they would like to die, how they would like to die, who they would like to be there with them. I've had conversations with young people who have come in at the start of their cancer journey about sperm and variant tissue cryopreservation. So that, I don't know why it's funny. It's quite a serious issue. And those conversations have been handled in an incredibly capable way by young people. So young people are absolutely able to deal with difficult, complex information. They can be guided through that process in an absolutely natural and capable way. And certainly the ability, in my experience of young people, to deal with information should humble everyone in this place. And many of the late effects of cancer are really the rich goldmine that we should look at when we consider the impact of puberty blockers that when somebody detransitions or make that decision to detransition, what impact that may have in later life, because there are parallels. When somebody has high-dose chemotherapy, all of their rapidly replicating cells can be deeply damaged, so they can completely lose their fertility. And so that's why sperm cryopreservation and ovarian tissue cryopreservation are really important. And these are the types of important questions that we need to interrogate and ask ourselves about this important debate. Moving on to the next part of consent is when consent is not possible. So I'm sorry to interrupt.
And I know that we have an informal time limit. He's gone slightly over that already. But I have just been advised there is a problem with the sound on the broadcast. So any members who have spoken while there's been a problem with the sound can be reassured their words will be recorded in Hansard, but they may not be available in the broadcast. So I've been advised to suspend the sitting for 5 minutes to allow the engineers to reconnect the sound. So I now suspend for 5 minutes.
Thank you very much.
The proceeding is currently suspended. 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 The proceeding is currently suspended.
Order. The technical issues, I am told, have been resolved, and we can resume. So I will ask you, Mr. Hanvey, to start where you left off.
Thank you, Mr. Mundell. It's now a pleasure to serve under your chairmanship. So the point that I was making really is about the provision of information to assist in decision-making in complex situations, but encouraging somebody down a path which could lead to irreversible medical decisions without the provision of such information and an opportunity to consider all possibilities is an unforgivable dereliction of professional duty. In her interim report, Dr. Cass states that primary and secondary care staff have told us that they feel under pressure to adopt an unquestioning affirmative approach, and that this is at odds with the standard process of clinical assessment and diagnosis that they have been trained to undertake in all other clinical encounters. And I agree with that. I agree with that fundamental principle. I think a point I should make very clear here is I'm drawing a distinction between someone who has arrived at a very clear and considered position of trans identity and someone who is embarking upon the exploration of that. They are two entirely different things, and we have a duty of care to understand that the therapeutic need within that process must be supportive, and I agree with every point that has been made that it should not be coercive on either side, and it must be balanced, it must be therapeutic, and it must always be patient-led. They should lead the conversation, lead the direction of that, and they should not be influenced in either way to arrive at a particular position. But certainly the points have been made by many honourable members today that we are not talking about therapeutic intervention for professionals, but we are talking about quackery, then this has satisfied some of my deep concerns about what this legislation would mean. And I'm glad that we've been able, that's why my remark at the beginning was that I'm glad that the government made the decision, that the petition was raised and we're having this conversation, because my experience of asking questions about legislation that are based on my considerable clinical experience has been to be accused of being a transphobe or even a homophobe, which would be a surprise to my husband, who we've been together for 28 years. He'd be news to him. But I think I would just wrap up, because I have gone on a little bit longer than intended, is that, you know, I oppose, I mean, I can't imagine what it must be like to be told that your identity is wrong when you know deep in your heart and your soul that that is who you are. It's an absolutely abhorrent practice, and it should be ruled out. But we must make it clear what therapy is and what quackery is. These are the fundamental questions that I have asked myself about what this legislation means, what we mustn't do is come down on either side where there's coercion against trans identity or unquestioning affirmation. It is absolutely vital to young people who are questioning their identity to have the kind of support and guidance that was denied to me when I was a young gay man growing up in the 70s and 80s. So, thanks very much, Mr. Mundell.
Thank you. Can I call Dame Nye Griffith and add my congratulations to her inclusion in Her Majesty's Birthday's Honours List?
Thank you very much indeed, Mr. Mundell. I'd like first of all to congratulate the Honourable Member for Carshalton and Wellington and my Honourable friend from Plymouth, Sutton and Devonport for excellent opening speeches, and I will try not to repeat too much of what they have said. I have to say I've been very saddened that it has taken the government so long to address the issue of I'm absolutely horrified the government is now retreating from including trans people in the ban. This is a shocking, broken promise. And I'd like to give apologies from the member of Swansea West who cannot be here owing to another speaking engagement. And just remind the Chamber, back in 2014, he introduced a private member's bill to ban gay conversion therapy, which included protecting trans people. So this legislation is long overdue. Let's be clear, conversion therapy is abhorrent. It sets out to direct an individual to one intended outcome. And as has been said and made very clear by many members, a ban on conversion therapy does not affect legitimate clinical consultations with medical professionals. Now, the effects of conversion therapy are devastating, from negative self-image to suicidal thoughts with potentially tragic consequences, every bit as devastating for trans people as for LGBT people. By retreating from making this a trans-inclusive ban, the government is, however, not only sending a message to trans people that it is not prepared to protect them, and leaving trans people exposed to the appalling damage that conversion therapy causes, but also, by excluding trans people from a conversion therapy ban, the government is sending a very transphobic message to wider society. And this is a very serious matter indeed. At a time when trans people are facing appalling abuse and bullying and discrimination, a time when we should all be taking a strong stance against transphobia in all its forms, the government should absolutely be setting a very, very strong example and making it clear that trans people are every bit as much valued as every other member of society. Now, the UK has in the past been a leader and champion of human rights on the international stage, but now we are in danger of sullying that reputation and falling badly behind. Other countries, as has been mentioned, New Zealand, Canada, France, have recently introduced trans-inclusive legislation. And of course, it is perfectly possible to draft appropriate wording. So now it is high time for the UK government to act immediately and to introduce fully trans-inclusive conversion therapy ban.
I'm afraid that some of the issues with the sound have re-emerged, but it's my proposal that we just continue with the debate. Hansard are fully taping and transcribing every word that is being said. So whatever contributions have been made or are to be made, they will be fully recorded. And on that basis, I call David Linden.
Thank you very much indeed, Mr Mundell. It's a pleasure to serve under your chairmanship, and I too congratulate the honourable gentleman from Carshalton and Wallington for opening the debate. I want to approach this debate speaking to somebody from the Christian faith, and I've tended to avoid in the last 5 years talking too much about faith in the chamber, partly because I don't want to be like pigeonholed as some sort of like mad Ned Flanders. But in all honesty, one of the first things that when I spoke in this house, I quoted from the Book of Micah, chapter 6, verse 8, when we as Christians are commanded to act justly, walk humbly, and love mercy. And the pledge that I made 5 years ago is that when considering issues in this place, I would try and approach everything that I do in here and apply those principles to that. And I must confess, I have hummed and hawed, as we would say, about taking part in this debate, because what people have seen as being the trans debate has become incredibly toxic. And I think for me, some of the most marginalised, most vulnerable people on the face of this planet have sadly been used as a political football, and we've seen elements of that today. So I want to try and bring to this debate a bit of a focus on faith and how I approach this subject, because as many people have already outlined, it is actually the vast majority of conversion therapy takes place in religious settlements, and for that I am deeply sorry and incredibly embarrassed. I think it is absolutely appalling and would condemn it in every form. Subscribes to a view of compassion. It does not subscribe to this idea of using this very vulnerable group of people as some sort of wedge issue, as some sort of political football, as is so often the case. And I do rather think that the government, in choosing to remove trans people from the ban on conversion therapy, are doing exactly that. This is being used as a wedge issue, and I think most of us in this room would know that. Anybody who tries to approach these debates, all of a sudden it gets boiled down to who can use toilets, what kind of genitalia people have got. I think that does a massive disservice to the debate. It gets away from the fact that trans people are subject to some of the worst mental health issues, some people who are contemplating suicide, and the idea that it gets boiled down in some pathetic radio phone-in asking people whether someone can have a penis, I think is deeply distasteful. And reflecting on, going back to that Christian theme, when we look in the Bible and we talk about the Good Samaritan didn't stop and ask someone what their pronouns were, didn't ask whether they were male, female, non-binary. They stood there to try and help people. And so for so many Christians, I would just ask them that as they approach this debate to do so with compassion, because far, far too often the church, in my view, has become absolutely obsessed about people's sexual orientation, people's gender, and they have done so at the expense of social justice and equality. We are commanded in the Bible to talk about faith, hope and love, but it says in the Bible that the greatest of these is love. I do not believe as a Christian that we can talk about practising love to other people whilst pursuing a ban on conversion therapy that is exclusive of trans people. So I very much support that ban on conversion therapy, but it must go further. It must include trans people, and we must try and have a much more grown-up debate that focuses on compassion and not the nonsense that we see far too often.
Thank you. Nadia Whittam.
Thank you, Mr Mundell, and it's a pleasure to serve under your chairship and to continue from my honourable friend who made a powerful speech. I'd like to thank and congratulate the honourable member for Carshalton and Wallington for securing this debate, and also the creators of the 145,000 people who signed it and ensured that it was debated here today. Mr Mundell, LGBTQ people don't need to be fixed or cured. There's nothing wrong with who we are. What is wrong is how society treats us. Mind, the mental health charity, has said that, and I quote, all forms of conversion practices can result in poor mental health. People have reported suicidal thoughts, self-harm and feelings of guilt, shame and self-hatred. And the United Nations has said that these practices can amount to torture. The government's 2018 National LGBT Survey found that 5% of LGBTQ people have been offered or threatened with conversion therapy, and 1 in 50 have been put through it. Trans people are twice as likely to have been offered conversion practices than those who are cisgender and gay or bi. This government has been promising for 4 years now that conversion practices for LGBTQ people will be banned. But now that a ban finally has made its way to the Queen's speech, in which conversion therapy was described as abhorrent, the proposals that it has put forward are discriminatory and unacceptable. If the government truly believes that conversion therapy is abhorrent, then why does it intend to ban practices aimed at changing a person's sexual orientation, but not aimed at their gender identity? Mind has described that differentiation as deeply disappointing, and I am extremely concerned that trans people's exclusion is yet another cynical attempt by this government to create a culture war between these different groups, that the government is scapegoating trans people who already face this tirade of violence and discrimination with the aim of stirring up so-called anti-woke sentiments. And we've seen it all before. The government does the same to migrants, the same to refugees, the same to people of colour. And we saw Thatcher's government whip up the same moral panic against gay people in the 1980s. I believe that just as society looks back at that time with disgust at how gay people were treated in decades gone by, we will also hang our heads in shame at trans people's treatment in decades to come. It's also deeply worrying, Mr. Mundell, that even for sexual orientation, the ban only covers under 18s. So that means that adults can consent to non-physical forms of conversion practices. People cannot consent to their own abuse, and that's what conversion therapy is. It should be banned without caveats. So I urge the Minister to listen to LGBTQ organisations, to mental health experts, to MPs here today, and to our constituents, and ban conversion practices for everyone in all circumstances.
Thank you. I now call Kirsten Oswald.
Thank you, Mr Mundell, and it's a pleasure to serve under your chairship. I'd also like to thank the Honourable Member for Carshalton and Wallington for the way that he introduced the debate today. I thought it was really helpful, the way that he pins down the specifics of what we are meant to be discussing here. And I'd also like to thank the 145,000 plus people who signed this petition, including all those from East Renfrewshire who signed, and the many who have been in touch with me on this issue to let me know of their deep concern at the gap in the proposals that this government is putting forward. And I'd also like to thank the many organisations who have kindly been in touch with briefings on this issue. I think the tone of the debate today has been an interesting one. I always wonder what these debates will actually be like, and I have to say that it's been really interesting to hear the groundswell, I think, from across this chamber of MPs saying that we are not okay with the gap here, that we think that conversion therapy should be banned in all circumstances. And that's really important, because we need to be clear that nobody's identity should be up for debate. Nobody's identity should be a political football. Nobody's rights should be diminished or compromised. And it's always important, I think, that we bear these things in mind when we consider the language that we are going to use when we're having this discussion, because what we say here has a significant impact on those outside the chamber too. So what are we talking about here? Conversion practices, I take the point that the Honourable Lady makes about the use of the word therapy. I think that's right. I believe that the Scottish Parliament is using the term conversion practices. But these are practices or conducts that are targeted at an individual with the intention of changing or suppressing that person's sexual orientation and or gender identity. And my friend, the Honourable Member for Ochil and South Perthshire, described very vividly the terrible reality of what that can mean. And the UK government itself has stated that there's no justification for these coercive and abhorrent practices. That being the case, I wonder why we're here, particularly when, again, the UK government's own research found that trans people are twice as likely to be subjected to or offered conversion practices as non-trans, lesbian, gay or bi people. And I think that the Honourable Member for Arfon it was who outlined the fact that banning conversion practices doesn't criminalise outcome-neutral, explorative conversations or therapy. It's only practices that have a targeted focus on directing someone towards a more acceptable, as the converter would have, outcome that would be criminalised. Because the bottom line, I think we need to be clear about here, is that conversion practices are abusive, they are deeply harmful, there's no excuse for that, and no one should be left at risk of these practices. And how did we get to this place? We did have a commitment from the UK government that they would ban conversion therapy, but then in April this year, with a series of quite extraordinary U-turns, they firstly said they planned to drop the ban, to legislate, they planned to drop their plan to ban to legislate conversion therapy, and then they correctly and predictably U-turned on that after there was a significant outcry, including from a number of people on the Conservative benches. But the U-turn was only partial, and I have to say it's inexplicable to me that we would suggest somehow that it's okay to ban conversion therapy and miss out this very vulnerable group. I thought that the speeches that the honourable members for Rutland and Milton and Darlington made today were particularly important in that regard, and I think that we do need to remember that there are significant numbers of voices who are not having any of the position of this UK government, because it is completely unjustifiable. It's a really disgraceful way, I think, to conduct themselves with no thought, as far as I can see, for the people who are directly affected. And I think that that's really disappointing because of the damage that that will cause to lives. And it's been reported that the UK government thinks that this is the correct course of action because there could be unintended consequences. Well, I think we need to be really clear here. I think that there will be very, very predictable consequences if this gap remains, and these consequences will be that people's lives will be continuing to be harmed, people will be continuing to be put into the most difficult situations, which will cause their lives to be significantly damaged.
Would my honourable friend give way? Yes, and would she recognise that one of the consequences is the fact that international conference that the UK government was so keen to trumpet, called Safe to Be Me, has been cancelled? Now, you and I are both deeply concerned about the UK's reputation, I know, but this in particular highlights just how far the UK has slipped on this issue, that people no longer want to come to our shores because of this.
I'm grateful to my honourable friend for making that point, and I think it's an important one. If you look at the standing of the UK in terms of the league table of places where there is a positive environment for people who want to be safe in their identity as members of the LGBT community, then it's slipping and slipping fast. And I think that members have made points that we should reflect upon. The honourable member for Carshalton and Wallington talked about the fact that the UK government's own survey pointed out the harms, as my honourable friend has just done. The honourable member for Edinburgh West again put it that there's ample evidence of the harms that are caused to trans people from conversion therapy. And the honourable member for Darlington pointed out that, and I'm paraphrasing here, but he said basically it's simply not okay to treat trans people as if they're ill and need to be cured. But it's not just us here in this room who are saying these things. We've heard that Mind and Relate and the Association of Christian Counsellors, the Scottish Human Rights Commission and many more have spoken out. And the BMA also has spoken out, and it doesn't mince its words. It says it must be banned in its entirety. It's extremely concerned that this intention has not been extended to transgender and non-binary people. It points to the UK government's own analysis in terms of the impacts on the mental health of trans people, who it notes are the most vulnerable already, with nearly 1 in 7 reporting that they have been offered or had conversion therapy. And it's not just the BMA, the Royal College of Nursing's annual congress voted overwhelmingly to support a total ban on conversion therapy. The British Psychological Society has made its views clear too. We've heard that the Church of Scotland has announced its General Assembly passing a motion calling for a ban on conversion therapy. And I've heard increasingly from people in my constituency with a strong religious faith who are also deeply concerned about the potential harm caused by not implementing a full ban. And my honourable friend, the member for Glasgow East, said that he hummed and hawed when he was thinking about whether he would come here and speak. And I have to say I am very glad that he came here. I already know that he's a thoughtful and compassionate man, but I think he demonstrated that today. I think it was a very important contribution, because there is a groundswell, again, among those with a strong religious faith. We've heard about the large numbers of religious figures and religious leaders who have spoken out on this already. There is no justification for a ban, and religion is not a justification for a gap in the ban, and religion is not a justification for a gap in the ban. So that recognition from all angles of the immense harm, I think, is really borne out by the people who are directly affected. And that's whose voices are perhaps missing a bit today, but that's who we should be listening to. And I was really interested to hear the Honourable Member for Oxford, West and Abingdon speaking, because I thought she pointed that out really well. So the experience of people that have already been harmed by conversion therapy, the experience of trans people in that regard, is what we need to consider when we think of the fact that this is somehow being left out of the provisions that are proposed. Like my honourable friend, the member for Stirling, I'm very glad that the SNP government in Scotland is clear about their commitment to make sure that everyone, regardless of sexual orientation or gender identity, is safe from conversion practices. And I think that it's notable that they have taken steps to make sure that there are voices of people who are directly affected included in their process. So they have an expert advisory group on ending conversion practice. That will include looking at support for victims and survivors, and that's something that we need to make sure we don't let slip as we move forward, because of course, whilst I and so many others in this room today are pushing to make sure that we do have a ban on conversion therapy, including trans people, there are so many people whose lives have already been irreparably damaged. The Scottish Government, of course, is only one of a number of countries who are taking that approach. We've heard about Northern Ireland. I understand that Wales is looking at this too. In the last year, Canada, New Zealand and France have all gone down this road, and nothing terrible has happened. Of course, it wouldn't. But the thing is, the way that the UK Government is approaching this issue at present is making life particularly difficult for trans people. This conversation in itself is making life harder for people who are already vulnerable. It's delighted to give way.
I'm grateful to her just to point out that Wales actually is, in this case, is Wales and England, and there are many of us who would actually welcome the opportunity for Wales to legislate on this matter, and it might be a point that the Minister would like to respond to when he gets up. Thank you.
I'm grateful to my honourable friend for that intervention. I'm sure that the Minister is taking note, and I'm sure he's heard the voices in Wales, as I have, who are talking about this. And the reason that this matters is because if we leave trans people out from a ban on conversion therapy, it waters down the impact of the ban for everyone else. It allows conversion therapy to come in by the back door, or the trap door, as the Honourable Member for Plymouth South and Devonport said it. And of course, many trans people are themselves LGB. It just makes everyone's identities just that little bit less secure, and everyone loses because of that. Because fundamentally, there's nothing wrong with being trans. That's what this all needs to come back to. Nobody needs to be cured. Nobody needs to be converted away from being themselves. So legislation here needs to reflect that fact. Now, I have criticised the UK Government, and make no apology for that, for U-turning repeatedly on this issue. But there is an opportunity for them to U-turn again. I think that I would certainly welcome that, and to do the correct thing, to make sure that this is an all-encompassing ban on conversion therapy. I know that the Minister is a very thoughtful Minister on this matter, and the only question that I really have for him today is what steps he is taking and what conversations he's having with his colleagues to make sure that this ban is a ban for all.
I call Annalise Dodds.
Thank you, Mr Mundell, and it's a pleasure to participate in this debate with you in the chair. And I'm very grateful to the petitioners and to the Honourable Member for Carshalton and Wallington for opening this debate in what's been universally acknowledged, I think, is a very sensitive and careful manner. Now, I think we're all aware that this discussion is taking place during the month of Pride, the 50th year since the first Pride March took place in London. This should be a month of celebration for LGBT+ people and their allies after the history of struggle that my friend for Jarrow very ably described. It should be a time to celebrate the wonderful diversity of our country and for all of us in this House to recommit to doing what we can to ensure every person in the UK is treated with dignity and respect, including LGBT people, and that they will always have the ability to love and live as they need to. And I think that the calls from my friends for Plymouth, Sutton and Devonport and from the City of Durham were extremely strong in that regard. Now, the government had ambitious plans to mark these 50 years of Pride through, as was mentioned, its flagship Safe to Be Me Global Equality Conference. However, the resignation of Ian Anderson and the withdrawal of over 100 LGBT plus organisations and charities from Safe to Be Me in April was a consequence of the government's decision to reverse its plans to ban trans conversion therapy, the subject, of course, of today's debate. And the policy process on this has been chaotic. On the 30th of March, the Minister told the House that the government was taking forward plans to ban conversion therapy in all its forms on an urgent basis. Just one day later, the news broke that the Prime Minister intended to ditch plans to ban all forms of conversion therapy. And then, one day after that, the government had to U-turn on that intention, only to then exclude trans conversion therapy from its plans. It appeared, Mr Mundell, that no one covering equalities issues on the government benches, from the Foreign Secretary and Women and Equalities Minister down, was informed of Number 10's intentions. As they changed, it appears, from hour to hour. At no point before April had the government suggested that it was treating trans conversion therapy practices differently from those targeting sexual orientation. Its consultation was, in fact, explicit that an attempt to change a person from being attracted to the same sex to being attracted to the opposite sex, or from not being transgender to being transgender, would be treated in the same way as the reverse scenario. As my honourable friend for Llanelli made clear, a ban on conversion therapy in all its forms is very long overdue. So I have to ask, as so many have asked during this debate, why has the government changed its mind on this subject when so many expert organisations hold a different point of view? The BMA calling conversion therapy an unethical and damaging practice that preys on victims of homophobia, transphobia, discrimination and bullying. The Royal College of Psychiatrists saying conversion therapy causes severe physical and psychological suffering. So many others have been mentioned in this debate by my friend for Nottingham East when she referred to the mental health charity Minds comments in this regard. The NHS Confederation as well, the British Psychological Society. I could go on and on and on. And this is not just at national level, it's also at local level, as quite rightly was referred to by my friend for Newport West with the organisation she has been in contact with. Many of those organisations that I've just listed have acknowledged, as Labour has, the need for clarity when introducing legislation of this kind. That's why Labour is clear that a trans-inclusive ban must not cover psychological support and treatment, non-directive counselling, or the pastoral relationship between teachers and pupils, or religious leaders and worshippers. And I think the speech from the member for Glasgow East made that particularly clear.
On friend give way. My honourable friend's giving a customary excellent speech on this matter. I just want to tell her that when I went to see one of my oldest and best friends, Imran, last year, his child was coming out as trans, coming out as Hope. And I thought I would share Imran's and Hope's words with you today. Hope told me, I'm Hope and I'm 16. I've decided to live my life as female. My home has been very supportive. My parents have done everything they can for me. School has been supportive, especially my friends and teachers have been respectful. Some students have been unkind. The attitude that most people have shown me should be the norm. Trans people are treated differently and we need to educate people. Imran said to me, it doesn't matter what your child does or says, but it's your job to unconditionally love and support them. I hope we can carry their positivity and do our best for trans people and bring forward the ban.
Well, I'm very grateful to my friend for making that point and sharing that experience. And I would say very, very clearly, and in response to the comments of the member for Don Valley, of course, a ban must also not cover discussions within families. And those discussions are based in that need for love and support, as was quite rightly mentioned there. Now, it's also, of course, imperative that a trans-inclusive ban must not impact on the provision of services for children and young people. Indeed, the CAS review, the interim CAS review, has highlighted the extent to which there's a disturbing lack of support and healthcare for children and young people with gender dysphoria, especially when it's accompanied by an additional diagnosis that requires care. More, much more support and counselling is needed, not less. And I agree with the comments here of the Honourable Member for Carshalton and Wallington that any ban must be, of course, carefully, tightly and clearly worded, and of course appropriately implemented and assessed. Indeed, the Government's own consultation on its initial proposals made that very clear. As my honourable friend for Llanelli herself said, this is not beyond the wit of man or woman in this place. It is what we surely do every day as legislators, and we will do it in respect of this ban too.
I'm really grateful to my honourable friend giving way, who's making an excellent speech. Does she not agree with me, however, that when we're talking about issues of coercion and control, when we're talking about issues of safeguarding, that has got to be inclusive, and therefore there is no rationale behind exclusion of one particular group in our society over another?
I'm grateful to my friend for that really important comment, and indeed there is no rationale for exclusion, and ministers have had almost 4 years to work up a ban on all forms of conversion therapy, which does not inadvertently restrict access to legitimate, non-coercive forms of treatment. As so many have said during this debate, they could have looked to the examples of other countries that have managed to produce bans without any evidence of such unintended consequences. And the majority of countries that have introduced some form of national level restrictions against conversion therapy have done so, including trans people, and more are proposing to follow suit. So to conclude, I have some direct questions for the Minister. Please can he explain to us whether he and his government have gathered any evidence on the impact of such a ban on the provision of legitimate talking therapies? If they've gathered any evidence, any statements from medical bodies after conversion therapy bans suggesting that there are any concerns about chilling effects, and if he's gathered any evidence to suggest that a trans-inclusive ban would put such treatments at risk. I have to say I've been unable to find any such evidence. I believe that's because such evidence does not exist. I anticipate the Minister will argue that the complexity of issues I've mentioned will require his government to consider the issue of transgender conversion therapy further. Well, if that's to be the case, I hope that finally he'll use his remarks to set out in explicit detail a timetable for such a period of consideration. If further information on how a trans-inclusive ban will work must be sought, according to his government, will he detail that timetable and how that process is to be undertaken? When does the government intend to make a final decision on this issue? Are we going to be back here, Mr Mundell, in another year's time, asking exactly the same questions? If so, I do genuinely fear for the impact on trans people in the interim, who surely only want to live their lives in dignity and free from abuse, just like everybody else.
I call Minister Mike Freer.
Thank you, Mr Mundell. It's a pleasure to serve under your chairmanship. Could I also start by thanking the petitioner for securing this debate and the 145,000 people who signed it. Also, on a personal note, I'd like to thank and recognise the 50th anniversary of Pride, and in thanking those who went before me to secure the rights that I have today. And I sometimes do think we should, whilst we get caught up in the heat of the debate of the issues that we have to address, it is important sometimes to look back and remember that we have made progress, and let's not lose sight of the progress we've made whilst agreeing that we still have further work to be done. I have to say I did welcome the debate because it is a piece of legislation that I spent a considerable amount of time and energy on, not least in trying to myth-bust much of the nonsense that is going around what is and what isn't conversion practices. And I did want to thank my honourable friend, the member for Carshalton and Wallington, not just for securing the debate, what I thought was not just a powerful but actually a very thoughtful speech, and actually a speech that he could have made from this position in this room, perhaps one day. But I have to say, Mr Mundell, that actually the debate actually saddens me. I'm genuinely sad that we are here yet again having this debate. It saddens me that we have yet to achieve consensus on many of the more thorny or heated topics that people disagree on or choose to misunderstand. And that is a real it is a real regret that, having spent so much time trying to explain to people what is and what isn't conversion practices, that we continue to have this debate. And so from that point of view, since taking up the position of looking after LGBT issues in the Equalities Brief, I have genuinely tried to seek that consensus, but tried to pursue the debate with a degree of honesty and a degree of respect, and trying to remove the toxicity from the debate that we've been having so far. Because many of us don't have direct experience of trans issues. Some of us do. And I get deeply frustrated when colleagues make comments about the trans community from what I believe to be a position of ignorance, but also comments that hurt colleagues in this House. The trans community are not some invisible, amorphous blob that people cannot recognise. These are our friends, these are our colleagues. We have members of this House with trans siblings, with trans children. We have our first trans member of Parliament. And it deeply saddens me that we still have comments being made that are, if not designed to be hurtful, are hurtful in themselves. I've also taken time to speak to many of the survivors who have been through conversion practices, some of them decades ago, and it's quite clear from speaking to the survivors that the trauma that they still live with today. But also speaking to people who have survived conversion therapy more recently. And so when people say it no longer exists, that's absolute, utter nonsense. They just need to go out and talk to people who have survived it, whose partners have committed suicide, or whose children, they've seen children taken abroad to be sent to conversion camps or to be married off. And so it deeply saddens me when people continue to deny the existence of conversion practices. Yes, many of the more abhorrent physical acts are illegal, but the pernicious, insidious, coercive therapies, as they are so called, is what we are trying to address. That is what is still present today. And when we talk about, colleagues have talked about if like rape as a tool of correcting people's behaviour, then part of the bill that is being drafted will ensure that that remains, whilst rape is obviously an illegal act, but using rape in the way that members have described would be an aggravating factor. And that's the difference. So when people said, what is this bill going to change in law that is not already illegal? That is one example. Where people use corrective rape, it would be an aggravating factor, and that is not currently available. And so I do also want to recognise the strength of feeling that people have to make sure that the bill includes trans. And I want to make it abundantly clear that the bill will protect everyone from coercive attempts to change their sexual orientation. And we do not agree with attempts to change someone's gender, but we do wish to ensure that any action that we bring forward on transgender conversion practices don't have wider implications, such as accessing legitimate therapies. I also wanted to, and I referenced at the start, the sadness I felt that we've not been able to get to consensus. And whilst I'm obviously disappointed that we have not brought forward a fully inclusive bill, that's fairly obvious from my previous statements. But in terms of where do we go from here, I want to use that piece of work that is currently being scoped out, that I hope will be at pace, so as the bill proceeds, we're able to have an informed bill passage so that we can try and address those issues of how do we ensure, with cast iron clarity, if you can have cast iron clarity, that clinicians are protected, that questioning someone's gender discomfort, because dysphoria is the clinical end of the process, if I'll get corrected if I get it wrong, but when someone is suffering from gender distress, a clinician needs to have absolute clarity of protection, that their ability to explore why their client is feeling that way is not conversion practices. I think the honourable friend wanted to come in.
I thank my honourable friend for giving way, and I think a lot of people will be very reassured by the tone of his comments, because there is genuine fear that legitimate practices would be outlawed. But could you just perhaps address one of the issues we have is that campaigners are looking at other laws elsewhere, which has perhaps led them to reach conclusions about what will be in his bill, which perhaps won't be. But should he perhaps just say what the timescale will be for a draft bill, and to say that actually no one can predict what will be in the legislation because we've not seen it yet?
I thank my honourable friend for asking for that clarification. It is certainly my intention that the draft bill, which is expected to be narrow in scope, which clearly sets out what is and what isn't a conversion practice, so that we have that clarity, should be brought forward, I would hope, September, October of this year. Okay.
I have a lot of time for this, Minister, and I think his heart is in the right place. The words he just used about a narrow scope, is the intention of the government that we'll have a bill of such a narrow scope that an amendment to include trans and non-binary conversion therapies and practices within a ban would be excluded, so the will of the House could not be tested, so MPs would not have the chance to vote for it? Is that the intention that he just set out there?
I thank the honourable gentleman. I know spends a lot of time on this, and I think that probably we are of a similar mindset in terms of where we want to get to. I think that it would be very difficult, and I'm straying into parliamentary draftsmanship. I think it is possible to draft a bill that ensures that attempts to reopen the Equalities Act or to reopen the GRA would be out of scope. And I think that is one of the dangers. If we write a bill that is open to being amended to widen the debate away from conversion therapy, I think that is a risk, and why I'm trying to ensure the bill is narrow. But a bill that is around conversion practices, I can't give that cast iron guarantee because I'm not the parliamentary draftsperson, would be amendable. That's how I see it. And of course, that is a debate for another time. But the purpose of the bill is that it remains narrow, so that it is limited to conversion practices, but it doesn't allow the bill to be hijacked and get caught up in other debates about other issues. I'm hoping that we can keep it very, very narrow. And in terms of the extra work that we're scoping out and hoping to be done at pace, it is about ensuring that legitimate clinicians and therapists have that protection from being able to explore all the reasons why somebody might be suffering from gender distress. It's also to make it abundantly clear that parents can have those robust conversations with their children. There is nothing wrong with a parent disagreeing with their child's trans status or sexual orientation. That is not a conversion practice.
It really is a good debate that we are having here, but can he confirm that conversion practices are those who are aimed at a certain outcome, and therefore what he is describing, i.e. an open conversation to explore your gender identity, is of course not what a ban should include, but all practices with a closed outcome should be banned, and that should include trans people.
In terms of the definition of a conversion practice, that is clearly where a person has a predetermined outcome to take that person away from being trans and pushing them to be not trans, being straight, being gay and straight, which would be symmetrical. The key in terms of the additional work that I'm seeking to get undertaken at pace is the clarity that we need to ensure that the clinicians are protected, that parents are protected, that teachers are protected, to ensure that the chilling effect, as some of the clinicians and therapists have expressed some concern on, are equally mitigated. It's also, if you look at the CAS report, it does reference how affirmative therapy could be abused. It's not my understanding that you'll always find in any practice, you'll always find a rogue practitioner. But in terms of how affirmative therapy should be performed, that is legitimate. But again, it is achieving clarity so that people are not caught and be made to feel that they have practiced conversion therapy by simply being a good therapist or being a good clinician. And that is why the work that we're trying to have scoped and done at pace will, I hope, allow us to achieve that consensus and put to bed many of the fears and concerns that people have legitimately expressed. And so whilst I am clearly disappointed that we're having this debate again and we are where we are, I do feel it is not unreasonable to take some extra time to try and build that consensus so that when the bill or a bill comes forward, that we're able to make it as inclusive as possible. I can't guarantee that we'll get there, but that's my aim and objective. But I don't think it is wrong to spend that extra time to ensure that we try and ensure that we can build as much consensus as possible. If I could turn, Mr. Mundell, just on a couple of things that have been raised. I think, we talked about the trans healthcare, and clearly the interim report from Dr. Cass, which I've spoken to her a couple of times, and she's clearly put a lot of thought into how we need to reform the healthcare system for trans, not just under 18s, but in general. The idea that people wake up on a Monday morning, decide they want to change their agenda, and by Friday they've been, banged through surgery is clearly a nonsense. I mean, anybody who spent any time looking at the whole trans journey knows it is cumbersome, it is not patient-centred, it doesn't work, and it forces too many people to opt out, and quite often, as my honourable friend Thurrock said, buy things on the internet, the Wild West, where we do not know what they are doing and what they're being exposed to. So that piece of work is an important piece of work alongside the work we're doing on conversion practices. I did want to just reiterate that those calls that the ban on conversion practices should wait until Dr. Cass has reported in full and then the government responds to that is missing the point. First of all, Dr. Cass has herself said that our work is complementary. We are not sequential, and that her work is not a reason not to bring forward the legislation. And she's made that abundantly clear. And in fact, she's gone as far as publishing a Q&A on her website, which clearly says that the CAS review was commissioned as an independent review on NHS gender identity services, blah, blah, blah. It does not include consideration of proposed legislation to ban conversion therapy. No LGBTQ+ group should be subjected to conversion therapy. However, through its work with clinical professionals, the review recognises that the drafting of any legislation will be of paramount importance in building the confidence of clinicians working in this area. That's what Dr. Cass said and she's absolutely spot on. I just want to put on record a couple of other things, Mr. Mundell. We talked about, people have raised a victim support service. The victim support service is already operating now. Gallup is running that, and it is also fully inclusive for anybody who believes that they have been subject to conversion practices or at risk of those practices, regardless of their sexuality, gender or non-binary identity. It's being run by Gallup. Gallup, as we know, is our leading LGBT anti-violence charity, and it does have significant expertise in that area of work. And if I could conclude, Mr. Mundell, I remain wholly committed to delivering our commitment to banning conversion practices and protecting victims and survivors. And I know many of my colleagues from across the House in this room are equally committed to realising that goal. We do have to work together to try and ensure the legislation is right, and I do want to ensure that we are seen to be supportive of people in their right of who they are, and it is not our job to interfere in how people see themselves. It is a matter of autonomy and dignity, and I thank all colleagues for their contribution, and I look forward to working together to make the bill a success.
I now call Elliot Colburn to wind up the debate.
Thank you, Mr. Mundell, and it's a pleasure to serve under your chairmanship at the end of this debate. Could I also join the Minister in thanking all honourable and right honourable members for their contributions today? Could I also put on record my thanks to the petitioner, Samantha, but also the Petitions Committee staff who have done such an excellent job of public engagement in the run-up to today's debate. I wanted to put on record my thanks to them. Can I thank the Minister for his carefully considered response? I do think in him we are lucky to have, and I'm not just saying that because of the kind words he had to say about me. It is true that we are shooting a little bit in the dark with this debate today because, of course, the bill hasn't been published. Indeed, I got heckled earlier by someone who's no longer in their place to say, well, that's the title of the bill. Well, no one knows, so I hope they come back and correct the record. But can I welcome the fact that the Minister has also used the phrase conversion practices rather than therapy. Indeed, in New Zealand, the bill that they have just passed is the Conversion Practices Act, and I believe that is something that should be replicated. And whilst there are complexities, I've never been one to believe that complexity means that we shouldn't do what is right, because at the end of the day, conversion therapy, as we've heard, and all the evidence sets out, is harmful, it's degrading, and it doesn't work. No one should go through it, and therefore we have the opportunity to make sure no one does.
Thank you. The question is that this House has considered e-petition 613556 relating to transgender conversion therapy. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting stands adjourned.